All right, welcome back to ABA Exam Review and our BCBA Exam Practice Questions series, where we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass, let us know so we can include you in the Sunday shoutout. Work hard, study hard. Let's get going. A research lab is funded through a grant that studies the impact of sugar intake on orca whales. The research lab must design an experiment and implement that experiment several times with the orca whales in the Atlantic Ocean. What type of replication is this most like? When talking about replication and experimental designs, we typically focus on two types. We focus on systematic replication and direct replication. Direct replication, we are more concerned with internal validity. Do we have functional control? Do we have experimental control? Are we controlling the dependent variable? With systematic replication, we're more concerned with external validity. Will our findings generalize? In this case, will our findings generalize to blue whales in the Pacific Ocean or whatever other whales or sea life that they might experiment on? However, they're not concerned with that quite yet. The research lab is designing the experiment and then implement that experiment with the same orca whales in the same Atlantic Ocean over and over and over and over again. Because apparently they're looking to establish experimental control and internal validity before branching out. So, what type of replication is that? A, systematic replication. Well, we just talked about systematic replication being more concerned with external validity, where you're systematically changing things in the experiment, not what's happening here, right? What they're not doing is unsystematic replication. You would never want to unsystematically replicate anything. That would be more akin to randomly changing things with no plan. So what they're doing is C, direct replication. They're going to directly replicate this experiment several times with orca whales in the Atlantic Ocean to establish, hopefully, a functional relationship and some sort of experimental control. And then maybe only then will they do systematic replication and look at external validity. What type of replication is this most like? C, direct replication. Gregory is ready to defend his dissertation and graduate from his doctoral program. He's practiced presenting several times and has nailed his presentation the last 2 months. He arrives on the day of the defense and sees a professor that he has bad history with in the audience. He tries to begin, but forgets his opening remarks. What is occurring? This happens a lot in behavior, right? We have a skill we know we can do. Sometimes, look, we call this choking in athletics, right? You know you have that skill. In the moment, though, you can't perform it. Somebody chokes and can't execute a skill during a presentation or a play or whatever it might be. It's a problem, right? In Gregory's case, he's ready to defend the dissertation. He's practiced several times. He's nailed it. He clearly has the skill. He knows how to do it. He's got control over this presentation. The presentation has stimulus control over his behavior. Everything is great, except when he gets to the defense, he sees a professor in the environment and he forgets his opening remarks. So what's occurred? A, masking. Yes, masking occurs when there is stimulus control, except somebody can't engage in a response or the response is not evoked because of another stimulus more salient or salient in the environment. In this case, the salient stimulus is the professor. The professor's presence is masking Gregory's ability to engage in his presentation. Overshadowing is when the response is not yet known, there is no stimulus control yet, and we can't establish stimulus control because of a different stimulus in the environment. So when thinking of masking and overshadowing, think of masking as stimulus control already being present. There's the response is already present. It just can't be evoked because of another stimulus. Overshadowing, there is no stimulus control yet. We're trying to establish stimulus control. We're not overgeneralizing because Gregory isn't trying to defend in inappropriate times or places. And choking is not a technical term, right? But masking is kind of akin to choking. If you're trying to ask out your crush and you freeze up, right? Well, you can't say the words or you forget what you're going to say. Your behavior was masked because of the other salient stimulus in the environment. So, what is occurring here? A, masking. Think of masking and overshadowing as two very similar ideas, both having to do with stimulus control. Masking, it's already established. Overshadowing, we're attempting to establish it. A multiple baseline design is implemented to evaluate the effects of a push-up program for 3 Army recruits. After the procedure begins, how should the interventionist select which baseline to intervene on first? I like this question because a lot of people see multiple baseline graphs and they just always assume, well, whatever first participant or setting it was, that's just probably the rule. You always have to pick one. But that isn't necessarily the case. So how do we select which baseline to start on when we have multiple baseline designs? A, choose the most unstable baseline first. Well, that's really never going to be the answer because we're always looking for a stable state for baseline. Even in withdrawal designs, when we're dealing with maybe a single participant, we always want that baseline to be as stable as possible. B, choose the baseline of the first participant on the list. Again, that's not very systematic. We want to be more systematic about this. And systematic just means planned. C, choose the most stable baseline of the participants. Okay, much better. We're looking for the stable baseline. So if we have one baseline that's decreasing sharply, one that's increasing sharply, and then one that's just very stable in a stable state, we might choose that one. Now, what's our rule? Always read all of your answer choices. So D, choose the most stable baseline of the participants unless there are other reasons for using a particular order. And D is just stronger. And sometimes on the exam, you're going to have two answers that could or could not be right, and one might just be better. D is just a stronger, better answer. It's more specific. Yes, you want to choose the most stable baseline, but if there's a specific reason, as in maybe one participant can only stay in the study for so long, who knows, right? But if there's reasons, then yeah, you're going to use a particular order. But if not, you're going to find the most stable baseline and go from there. So how should the interventionist select which baseline to intervene on first? Well, you're going to choose the most stable baseline of the participants unless there are other reasons for using a particular order. A group of friends take a road trip to the beach. Jay is sitting in the back seat when he sees an 18-wheeler approaching. He looks at the driver of the 18-wheeler and makes a honking motion with his arm. The driver of the 18-wheeler honks his horn. Jay is considered what? We've got a modeling and imitation question. I've done a lot of modeling and imitation questions recently in these past set of videos because I was getting questions about it, and it's a concept that I don't think is difficult to understand, but it's a little more technical than at first glance, right? There's a little more to it. So we know that modeling and imitation go hand in hand. The model is the person doing it. The imitator is obviously imitating the model's behavior. In this case, we're looking at Jay. What is Jay considered? Well, Jay is in the back seat. He sees the 18-wheeler. He makes the honking motion with his arm. The driver honks his horn. So Jay is clearly the model. He's not A, the imitator. Question becomes, is he a planned model or an unplanned model? Well, the difference is a planned model is contrived, it's set up, and it's anticipated. An unplanned model occurs more in the natural environment. Think of unplanned as more naturalistic and planned as more discrete. Well, Jay planned this, right? Jay planned this model, and he planned trying to model this for the 18-wheeler driver who saw him and imitated. An unplanned model would be you've never ridden the subway, and so you're just looking around at the other people on the subway, trying to figure out what it is you need to do. Again, think of planned as more discrete. Think of unplanned as more naturalistic. Jay is very planned. He knows he's going to do this, and he's hoping the 18-wheeler driver imitates his model, and he does. So Jay is considered a planned model. A jazz musician is upset because his manager wants him to play more modern versions of classic jazz songs. The musician says that the modern versions are not what people want to hear, but the manager says that attendance and profit are up at the club. The manager is exercising what assumption? All right, assumptions, things like determinism, pragmatism, empiricism, selectionism, on and on and on, right? So we're looking at the manager's behavior. Remember, we always want to identify who we're looking at in our scenario. In this case, it's the manager. And what does the manager say? Well, he's responding to the jazz musician who's upset because the manager says, well, we need to play more modern versions of classic jazz. Musician, being a musician, says, well, that's not what people want to hear. The manager rebuts by saying, well, attendance and profit are up at the club. What do you want me to say? I.e., we can argue back and forth, but data show that it is what people want to hear. What assumption is the manager using? A, determinism. Well, determinism says universe is lawful and orderly, behavior happens for a reason. We're not really looking at behavior here. We're not looking at behavior change or why behavior is happening. We're not debating the merits of that. This isn't really a deterministic thing. B, pragmatism. The manager is being pragmatic. He's using results to make his decisions. He's not saying, well, I like it better. He's not saying it's better music. He's not saying the jazz musician is wrong. He's just saying, look, data show that attendance and profit are up. I'm being pragmatic. I've got to make results-driven decisions. That's what I'm doing. He's being very pragmatic. C, philosophical doubt. You can maybe argue the jazz musician is engaging in philosophical doubt if he's trying to argue with the manager about the data or anything like that. But there's not much doubt going on the manager's part. He's just saying, I'm being pragmatic. This is what results show. And then D, selectionism. It's why behavior persists. Again, it's not really a behavior question. We're not really targeting behavior here or looking at a specific behavior. We're simply looking at the bigger picture, which is the manager is doing. Being pragmatic involves looking at the big picture. It involves looking at data, what the data show, what the results show, and making data-driven decisions based on results. You're being very pragmatic about the decision, and that's what the manager is doing. We're going to continue playing these songs because data show that it's better for the club. So the manager is exercising what assumption? B, pragmatism. Behavior analyst meets with the parent to discuss the most recent treatment plan updates. Parent requests that the behavior analyst uses an alternative strategy to teach frustration tolerance. When asked what strategy they should use, the parent says to use social emotional learning instead of behavior analysis, but only for frustration targets. The behavior analyst agrees. Has the behavior analyst done anything wrong? All right, sort of an ethical question combined with what looks like a dimension or deterministic or assumption question. And we're looking at the behavior analyst decision to use social emotional learning instead of behavior analysis. And right there, that should set off alarm bells. Not because social emotional learning isn't important and not because it isn't empirically validated. If we're not using behavior analysis, what have we failed to do? And that's the true issue here. Okay. Had the parent said, well, I want you to incorporate SEL along with behavior analysis and ABA, that's a different story because we're still incorporating principles of behavior. If the behavior analyst agrees to not use any concepts of behavior, that's an issue. So has the behavior analyst done anything wrong? A, no, the parent should be involved in the treatment plan decision making. Absolutely, but that's not the issue at hand. Not the fact that the parent is making a request, which they should do. It's the request the analyst agreed to. B, yes, the behavior analyst violated the applied dimension. Well, no, not necessarily. Frustration tolerance is an applied behavior. It's something that's going to be socially valid. It's a good target. C, yes, the behavior analyst violated the conceptually systematic dimension. Yes. If we're not using behavior principles, we're not being conceptually systematic. We must be conceptually systematic. There's nothing wrong with using other strategies in conjunction with behavior analytic strategies. You can't just throw it away and use different interventions depending on the day. You're a behavior analyst. You must be conceptually systematic. And then D, yes, the behavior analyst violated the assumption of determinism. No, he's not arguing why something's happening or the cause. The problem is he said, okay, I won't use behavior analysis. I'm only going to use SEL. We can't throw away our principles and our concepts and our science. We have to be conceptually systematic. So C, yes, the behavior analyst violated the conceptually systematic dimension. A mom is tired of her kids crying and screaming whenever they want to go to the park. Now, even if the kids are crying and screaming, she will only take them to the park if they say, can we please go to the park? What type of intervention is this? Pretty easy differential reinforcement question. Remember, there's a lot of questions on the exam. Some are going to be easy. Don't panic. People panic when they get easy questions. They overthink it. They say, well, this is too easy. Not everything's going to be the hardest question in the world. So when you get an easy question, celebrate. Answer it to the best of your ability, move on. In this case, differential reinforcement question. So differential reinforcement, ask yourself first, am I teaching a replacement behavior? In this case, we're teaching, can we please go to the park? So if we're teaching a replacement behavior, we can eliminate all our differential reinforcements except for DRI and DRA. DRO doesn't teach a replacement because we reinforce in the absence of a behavior. DRD is just trying to reduce the behavior that's already present. DRI and DRA are actually teaching a replacement. So we're teaching a replacement. Can we please go to the park to replace crying and screaming? So the question becomes, can the phrase, can we please go to the park, occur at the same time as crying and screaming? Yes, it can. So is it incompatible? No, but it is alternative. So what type of intervention is this? The DRA. Pretty straightforward. Finally, transition into the clinic is a difficult task for a new client. The behavior analyst wants to track transitions without crying. After 2 weeks, the technician reports transitions without crying occurred 8 out of 14 days. This type of measurement resembles what? Now, what type of measurement is this? Well, what are we going to do with that 8 out of 14? Probably turn it into a percentage and probably going to get 57%. So we're going to say crying or transition without crying occurred 57% of the days. Because remember, when we are setting different goals and mastery criterion, we're usually saying some sort of percentage mastery. 8 out of 14, 57%. So what type of measurement is that? A, duration. It's not duration. We're not looking at the length of any one response. B, inter-response time. We're not looking at time in between transitions. C, trials to criterion. Be careful. Do we have a criterion? We don't. We simply took data for 2 weeks. We didn't set any mastery criterion. What we're doing is percentage of opportunity. Of opportunities available, 14, what percentage did they engage in the target behavior? 8. So the type of measurement that this resembles is D, percentage of opportunity. Thanks for watching. Check out behavioranalyststudy.com for all of our study materials. Let us know when you pass. Work hard. Study hard. See you soon.